The senator from West Virginia.
Thank you, Mr. President. And I'd like to thank my fellow senator from Louisiana, Senator Cassidy, Dr. Cassidy, for his really creative ideas, the world's greatest health plan, the way he frames it in terms of his years of practice, and the sincerity with which I know he has practiced in all kinds of healthcare settings and done a lot of work with folks who never could or never would have afforded health insurance. So, Dr. Cassidy, thank you for what you're doing and joining with us to try to solve this issue. Mr. President, I rise today to join many of my colleagues in sharing the realities of Obamacare. We've heard a lot about this. My home state of West Virginia, for many, this law has been nothing short of devastating. While the number of people insured has increased because of the expansion of Medicaid in my state, the way these policies were put into place has created possible catastrophic fiscal cliffs for states. My state, by the way, last fiscal year was over $300 million in the hole because of other issues, and now they're looking at this fiscal cliff of having to pay full freight for the Medicaid expansion. There is now a segment of our population who is falling through the cracks when it comes to health reform. They make too much money to qualify for Medicaid or subsidies and end up paying the full cost of increasing individual coverage premiums. These families, these working families, are being faced with skyrocketing premiums, co-pays, and deductibles. Talk to any healthcare center, talk to the hospitals. This rising amount of deductibles is influencing their bottom line because they're chasing not uninsured, they're chasing now people's deductibles. And in my state and across this country, we have little, if any, choice in insurers. If you have seen that often repeated phrase, and I'll say it again, the claim, if you like your doctor, you can keep your doctor. This has been pure fiction. The provider and hospital networks have shrunk, and insurers have shifted away from options that give patients the choice that they were promised and that they counted on, and are now being pushed into much more restrictive plans. One of our local papers recently ran a story about a West Virginian in just this situation, a small business person who labeled this plan accurately, calling it the Unaffordable Care Act. Quote, since Obamacare, my premiums have increased at least $450 per month in the last couple of years. The plan I had was canceled, so if you can keep your health care, if you like your health care, you can keep it. His was canceled. False statement. And he had to enroll in a new plan. His premiums are currently over $1,350 a month. Between the high deductible and meeting the out-of-pocket maximum, this West Virginia has to pay 20% all out-of-pocket. And the situation is likely to get worse. In West Virginia, we, like many other states, are currently waiting to see what our premium increase is going to be for 2017. Hasn't been approved yet by the State Insurance Commissioner. The question is not whether there will be an increase. That is a given. The question is, how enormous will it be? If nearby states are any indication, there is much to be concerned about. In the state of Tennessee, the State Insurance Commissioner recently sounded the alarm, saying that the Obamacare exchange in Tennessee is very near collapse. Rates there have skyrocketed to between 44, and 62% increase. And sadly, this story is the same whether you're in Arizona, New Hampshire, Iowa, Nebraska, West Virginia. All too often, these rate increases are coming with much less coverage as well. I recently spoke with a West Virginia small business person who has absorbed the cost of the increased premium for their employee, realizing they can't afford it. But at the same time, that employee is getting much less coverage, higher deductibles, higher copays. Attempting to switch to a lower cost plan comes with its own perils. The average bronze plan deductible in 2016 was $5,700. And this is assuming that you have choices. A recent analysis by the Kaiser Family Foundation found that a third of all counties in the United States will only have one Obamacare insurer next year. This is up dramatically from the 7% of counties in 2016. And it is largely the result of major insurance companies scaling back or withdrawing their participation on the marketplaces. And unfortunately, there is nothing that it indicates that this trend will not continue. Many counties are becoming Obamacare ghost towns. In Pinell County, Arizona, 10,000 people bought exchange coverage this year, but no insurers are planning to offer plans on the exchange next year. What are they supposed to do? I fear this scenario could all too easily play out in West Virginia, where traditionally over the course of Obamacare, we've only had one insurer for the entire 55 counties. This year, we happen to have one insurer for 45 of the 55 counties. This lack of competition in the marketplace is nothing new for our state. This has been the reality for the vast majority of our residents, and now we're seeing it just expanding all across the country. This lack of choice, along with unaffordable premiums, co-pays, and high deductibles, has prompted most Americans to reject Obamacare plans and not even join. Nationwide enrollment in Obamacare exchanges is only half what was originally planned. We owe it to those we represent to do better. We've heard Senator Cassidy talk about his ideas. We have great ideas on this side of the aisle to improve, and we've asked and voted many times to throw out Obamacare and start over. I think that is the direction we need to go, because Americans deserve a health care system that works for them every day from year to year. And it's becoming clearer and clearer that Obamacare is not that plan. Thank you, Mr. President, and I yield back my time.